Hello, this is Aileen Ortega, and I will be presenting my signature assignment on a condition known as scoliosis. For etiology, I will first speak about what the underlying causes and risk factors there are. First, scoliosis can be acquired by an injury to the spine causing it to curve. Overall, it can be classified into three main categories known as idiopathic, congenital, or neuromuscular scoliosis. Idiopathic is the most common diagnosis, and it actually accounts for about 80% of diagnoses. It is used when there is no real cause for the scoliosis to appear, and it is mainly used on young children and those who are going through puberty. Congenital can cause curvature in any part of the spine that will happen during the embryonic stage. It forming during this stage means that it can be detected at a younger age than idiopathic. Neuromuscular scoliosis is used when the scoliosis is attributed or formed because of a neurological or muscular disease. This classification tends to regress the fastest, and examples can include spinal bifida and Duchenne muscular dystrophy. The main risk factors are age, which currently the age that it tends to be the highest in is around 10 or 11-year-olds. Sex, gender, females are more likely than men to get scoliosis, and a family history as well. So when you are being examined, you would be asked about any family history, and if it arises that a past family member has been diagnosed, then it is highly likely that you'll have it as well. For demographics overall, idiopathic scoliosis amounts for around 80% of all scoliosis cases, which again, idiopathic is used to diagnose when the real overall cause is unknown as to why the spine is curving. And scoliosis affects around 2 to 3% of the population, and 0.947% of those who are affected are primarily females, and it's 1.44 times higher than men. And 0.7% actually did undergo surgery from around 2011 to 2015, and this is according to Sung from 2021. For anatomy, the spine is made up of 24 vertebrae, and in between these vertebrae, there are intervertebral discs. These discs are important because they absorb any pressure from the spine, and in these vertebrae are intervertebral foramina, which let the spinal cord to pass through, and also nerves as well, and there are actually 31 nerves that go on each side of the spine. The spine can be broken down into 5 parts, which are the cervical vertebrae, thoracic vertebrae, lumbar vertebrae, the sacrum, and the coccyx. A normal or healthy spine will have an S shape when it's viewed from the side or laterally. And the cervical vertebrae, there are around 7 vertebrae. The thoracic will have 12 vertebrae, and the lumbar will have 5, but sometimes it can also have around 6 vertebrae, and that is completely normal or healthy. It does not change the anatomy in any way. The main way that scoliosis will affect the body is by curving it into an irregular S or C shape, and this curving can lead to compression on nerves that work with the central nervous system and can lead to back pain. Cerebrospinal fluid can also be disrupted by curving of the spinal cord and can lead to muscular dystrophy. And when focusing on the 3 main vertebrae, cervical scoliosis will push against the vertebrae and the brain stem and inhibit its ability to communicate with the thyroid gland. In thoracic scoliosis, it can make the ribcage to appear crooked and move laterally, which will make the shoulders to move unevenly and appear to be crooked on either side. It can also, the ribcage, when affected, it can also push against your heart and lungs. For scoliosis in the lumbar vertebrae, it can actually also affect the digestive system and cause things such as acid reflux or irritable bowel syndrome. The main symptoms of scoliosis are uneven shoulders, the head not being centered or aligned with the pelvis, hips becoming uneven, the rib cage becoming uneven, and the body appearing to not be straight or just lining up against with the pelvis, as I mentioned earlier. Other symptoms include back pain and trouble breathing, which the trouble breathing is attributed from the curving of the spinal cord, which moves the rib cage and it pushes against the lungs. For mortality rate, I found that around 6.5% of those with neuromuscular scoliosis have passed when undergoing surgery, and 0.3% of those with idiopathic have passed undergoing surgery. So the rate is actually very low, and those diagnosed with scoliosis can actually live a normal life and do many activities. When being diagnosed, you will first be asked about your medical history and family medical history, and then you will undergo a physical examination, which will be conducted by using an X-ray, MRI, or CT scans. And for CT scans, these images will be taken from the axial side. And when reviewing these images, something known as the Cobb method will be used to measure the spine. And usually if there's around a curve of 10 degrees, that's the minimum just to be diagnosed. Intermediate scoliosis is considered around 25 to 30 degrees, and severe scoliosis is 45 to 50 degrees. The most frequent test or method that is currently used, and it can be used in hospitals, clinics, but it's mostly used in schools, is the Adams Forward Bend test. And this test requires for the student or patient to put their feet together side by side and bend forward 90 degrees. And doing this test can actually get a good view of the alignment of the spine, rib cage, and shoulders. And it is also important to note that this test is just an initial diagnosis. So when doing this test, if you are sent to go see a doctor, that is where they can go get you properly diagnosed. For treatment, there are three main ways of being treated, and the first is commonly observation. Observation is used over a span of months, and it's used for, you would see it mostly in younger children because they're still going through puberty, so their spine is still growing. So they want to see how the spine grows and curves over a certain amount of time. Secondly, a brace can be prescribed if a physician wants to help slow down the curving. And the brace will work by actually putting pressure on the spine and is really only used on children since the children's spines are still developing. If you are diagnosed with a severe case such as neurological scoliosis, surgery will most likely be recommended, and it can be used. Surgery can be done doing an anterior approach or posterior approach. Which posterior approach, you'd just be laying on your front, and anterior approach, a piece of your rib cage will actually be removed so that they can go in through there. And finally, physical therapy can be done, and it'll be used to strengthen your back, arm, and leg muscles to help with any pain that is occurring. One form of artificial intelligence that I did find was a machine learning that was made to diagnose scoliosis. And this machine learning the people who made the machine learning created an algorithm with images from hospitals and universities. And these images were obtained with consent from those who the pictures were taken of. And the data was comprised of a total of 338 subjects who ranged from around the ages of 9 months to 79 years. And these subjects either had a healthy, normal spine, scoliosis, or spondylolisthesis. And these are my references. Thank you.